We're just going to start first with Pseudomonas. You should already be familiar with Pseudomonas. You know that it doesn't ferment anything. And why doesn't it ferment? Because it's a strict aerobe. Okay? So Pseudomonas are gram-negative rods that are oxidase positive. In this particular case, that is really an important point. All right? I mentioned it for Neisseria, but it's probably not even as important for Neisseria as it is for Pseudomonas. As I mentioned before, with the fact that Pseudomonas can cause similar diseases to all of the enteric bacteria, there has to be a good way to differentiate them. One of those is the fact that Pseudomonas can't ferment. We know it's a strict aerobe, okay? But the other thing that we can use is the oxidase test, because Pseudomonas is oxidase positive and all of the other enteric organisms are oxidase negative. So that's another test that sets it aside from all of those enteric bacteria. Okay? We're going to talk specifically about Pseudomonas aeruginosa. It's the most important pathogen in this genus. It has a lot of distinguishing features that you can see here. We talked about the fact that it was oxidase positive. We mentioned the fact that it was a non-fermenter. So those are clearly two very important properties. The other thing is that it is pigmented. They have piocyanin, which gives the organism, when it's grown on normal TSA agar, just kind of a blue-green appearance. That is crucial, okay, because a lot of the times when Pseudomonas is causing an infection, particularly at the cutaneous surfaces, the pus that you're going to see from Pseudomonas is going to have that blue-green appearance. That's when you're going to know that it's probably due to Pseudomonas. Additionally, you've got this grape-like odor, okay? Now, does that mean it smells good? I'm not going to say it smells good. I'm going to say it smells sweet, and it smells very different than all of the enteric organisms, all right? Remember that those go into a fermentative pathway. So those organisms, you tend to have a much more pungent and definitely not a sweet odor, all right? In burn units that have been colonized with Pseudomonas, where there's Pseudomonas in a lot of the patients in the burn units, as soon as you walk into that burn unit, you'll know there's Pseudomonas there because of that smell, all right? So the smell is a very distinguishing feature for Pseudomonas. It is also one of the organisms in our mnemonics. Some killers have pretty nice capsules. So it is an encapsulated organism. And I'm going to talk about when that capsule is really essential. All right. The reservoir for Pseudomonas is water. So it's ubiquitous. We find it in water. Therefore, transmission is through aerosols, water aerosols. In burn units, we no longer allow fresh cut flowers because it can transmit Pseudomonas. We don't allow raw vegetables because the water that they've been washed in could easily be contaminated with Pseudomonas. Okay? So those are some of the distinguishing features of Pseudomonas. The pathogenesis for Pseudomonas, of course, the capsule is going to be extremely important. Now, in this one, you can't swear that the capsule is going to be the most important virulence factor. And I'll tell you why. Number one, you've got a protein synthesis inhibiting toxin. That's also an extremely important virulence factor. In addition to this toxin that interferes with elongation, you have an endotoxin. So in Pseudomonas, you have endotoxin, which remember is LPS. You have this exotoxin that's secreted, and you have a capsule. Okay? So we have a lot of virulence factors really to think about with Pseudomonas. Now I'm going to go through some of the diseases with you, and in different individuals, you're going to get different presentations of disease from Pseudomonas. So we'll first start with healthy individuals. Healthy individuals can have gastroenteritis from Pseudomonas. Okay? Probably, if you were asked a question on a Pseudomonas infection in an otherwise healthy individual, probably one of the common things to show up would be hot tub folliculitis. Okay? Now, On hot tub folliculitis, you have to remember that Pseudomonas may not be the most common cause of that. All right? When you think folliculitis, the first thing that you should be thinking about is Staph aureus. Okay? But Pseudomonas aeruginosa would also be a cause of hot tub folliculitis. You can also get eye infections with Pseudomonas aeruginosa, and you can get eye ulcers, typically from when you had some type of a penetrating injury. So that's in healthy individuals. Now, when I think about Pseudomonas infection, the number one thing that pops into my mind are burn patients. Burn patients are very susceptible to Pseudomonas, and when it begins to colonize the skin, you can get a very, very severe cellulitis in which you get that blue-green pus, remember from the piocyanin, all right? It can then extend into the blood and you can become septic, and clearly when you become septic, you're going to worry about shock, and that would be, again, due to the LPS. All right, so burn patients, you got to be thinking about Pseudomonas. In neutropenic patients, they're going to be susceptible to a lot of different bacterial infections. Staph aureus we talked about, and Pseudomonas is no different here, and they're very susceptible to getting pneumonia and also sepsis. Now, chronic granulomatous disease we mentioned as well for Staph aureus. One of the things we don't mention frequently about Pseudomonas is that it's actually catalase positive. So it's going to be one of those bacteria that you're going to see recurring in people that have chronic granulomatous disease. Okay? As far as sepsis is concerned, the organism is not the leading cause of gram-negative sepsis. We're going to give that to E. coli. But in the same manner that E. coli can cause sepsis, Pseudomonas can cause sepsis. Now, the difference here is that Pseudomonas can extend back into the skin, and you can get a necrotic skin lesion called eczema gangrenosum with Pseudomonas when it gets into the blood. And probably it looks very similar to the black Escher that we talked about with cutaneous anthrax, okay? A little less edematous, okay? But it may look very similar to that. So that would be one thing you would have to differentiate this eczema gangrenosum from. Now, catheterized patients, urinary tract infections, we've talked about quite a few organisms that can do that. We're going to talk about some more when we get to the enteric organisms. Now, I told you when I think about Pseudomonas, I think about burn patients. Number 2 on my list for Pseudomonas is cystic fibrosis, okay? Kids that have cystic fibrosis have recurrent, very severe infections, pneumonia typically, with Pseudomonas aeruginosa. And one of the things you'll find in common with the strains that plague those children that have cystic fibrosis is that they're very, very slimy. They have that very thick encapsulated layers around them. It's very hard for those kids to eradicate the organism. You'll know that a lot of the times with CF patients, the parents will have to bang on the children's backs in order to help them try to loosen some of that up. Okay, so it's very, very sticky, very, very hard to get rid of. Now, diagnosis for Pseudomonas, of course, gram stain and culture. It's a non-fermenter. That should make it easy, and it's oxidase positive. Treatment for Pseudomonas is something you have to consider. It's actually a fairly resistant organism. So we treat with specific drugs we call anti-pseudomonal penicillins, and we're talking really about ticaracillin and piperacillin in that particular case. As far as prevention, again, not a whole lot we can do because it's ubiquitous, but we can make sure that we're not bringing that potential contaminated water into patients that really cannot handle a Pseudomonas infection, like, for example, in burn units.